So we're asking, why the big backlog that we've seen this week? One reason, human error.
As we learned at 5, someone at VDH missed a button, and as a result, that process has now been automated. Still, not a perfect system. 10 on your side, Stephanie Harris has more for us tonight.
Numbers. We rely on them to make decisions, to track trends, to tell a story.
The Virginia Department of Health reported 1,200 new cases of COVID-19 today.
But numbers can be deceiving.
There certainly, at least from my perspective, appears to be a lot of confusion, in the public.
Tim Powell is in charge of the COVID count at the Virginia Department of Health.
I think one of the challenges here is helping people understand the process.
When it comes to counting COVID deaths, there's no single system. Take a nursing home, for instance. If a health department worker is following a COVID patient who dies there, that death is almost instantly counted. But most are reported from a death certificate, which VDH doesn't see for about 30 days. And then a worker has to cross-check it before adding it to the list.
So this is a practice that normally happens once a year. And so we're now doing this on a weekly basis.
So the number you see in a single day really represents deaths over weeks. And to complicate matters, it may not even be a true reflection of COVID deaths.
If you think about influenza, same game. We don't really know how many people die from the flu.
If it's on the death certificate, it's counted. For instance, a cancer patient in hospice could count as a COVID death if they also have the virus.
Unfortunately, this is part of the inherent bias towards trying to rapidly respond to things.
So why not slow it down?
In all honesty, we're following directives that are coming down from the federal level.
People want instant information, a daily number, so Powell says that's what they're giving.
I really do stand by the fact that people are working incredibly hard to make it as accurate as we possibly can.
Powell says the best way to gauge COVID in a community isn't through single numbers, but trends. Look for the rate of incidence on the VDH website. I put a link on wavy.com. Stephanie Harris, 10 on your side.